patients don't like applications. I'm a Steve Jobsian, and so the product is really key, and you need to love what you do. This is dead on arrival. You go basically from thinking, oh, I'm going to be a billionaire, into the next day, how do I survive? And the companies that were successful were focusing on the people and on the processes to embed those technologies. 18 months to close a deal. And AI is a game changer. You try not to repeat your mistakes, but you do sometimes. Great questions. What was the question?
Welcome to our new episode of Digital Health Interviews. If you like this episode, please like this video and subscribe to our channel. So most of the times I know my guests from social media, or sometimes I even don't know them at all. But today is a different story. Actually, I'm interviewing today technically my ex-boss, since I worked for his company a little less than 10 years ago. And he came to Ukraine a few times. We had really great, productive, and motivational meetings. So I'm super happy to introduce my today's guest. His name is Amir Kishon. Hi, Amir.
Hi. Hi, Alex.
Let's start with your journey, which is definitely an amazing journey in digital health that's been going on for 30 years.
Don't scare me. No. It's I would say 25 years.
Okay, that changes everything. Yeah, tell me, how did the journey start and how's it going?
So I have a PhD in computer science, so I've sometimes used the term doctor, so they think that I'm originally from healthcare, but actually not. And when I done with my studies, I looked at what is available out there, and I wanted to do something with software, and I made a mistake, and I said, let's take healthcare and digital, and it was early in the 90s, and see what can be mixed out of that, what can be cooked out of that dish. Right. So I'm joking that it was a mistake, because I think that everyone that is in digital health knows that this industry has been kind of reinventing itself and trying to adjust to healthcare for the last 25 years.
Right. Let's talk a bit about Remedy Health. First of all, tell us, what was the startup about?
Remedy was our attempt to provide technologies to organizations and basically let them configure. This was early days of low code or no code, to configure patient engagement solutions. You can look at it very much like Squarespace or Wix to create your own patient engagement applications. We were joking that you can, with Remedy, you can create your own app in a nice afternoon, taking care of your diabetic patients or tracking your high-risk pregnancies and so on. So, according to the information on the LinkedIn, 17 years chapter of your life. Let's do a small reflection. Tell me what you think. Are there many things you would do differently today? And are you satisfied with how the journey ended? So that's a great question, because Remedy was actually 3 companies. I always joke that my professional lives are very much like a Shakespearean group of actors with the same actors, but we changed the play. So initially it was called dietwatch.com. It was an online dieting industry, and then we took this technology and provided it to diet organizations like Nutrisystem, Medifast, Atkins, and this was the second chapter. And the third chapter was taking this whole idea of engaging consumers and bringing that as a packaged online SaaS solution. Now you ask yourself, why the hell we changed? I think that one of the things that, as any entrepreneur, you learn the rules of the game, is that if you have a young company, it has a specific shelf life, and if you're not hitting that shelf life, and you start you're getting old, and you need to reinvent yourself. So we had to reinvent ourselves. So the last chapter of Remedy, which was called the second part, was Wellness Layers. Remedy was about 6-7 years.
Would you change anything right now with all your experience, if you could come back then?
This is really goes back, all the learnings. I try to improve myself as I go by from one company to the other. So I'm being drawn to lean startup approaches, and this allows us to provide the agility. And we talked about the fact that Remedy changed in 3 phases. So this was due to the fact that we were very agile and very lean in our environment. With the new company, Twig, we really started almost religiously on a lean startup approach. The guys that invented the whole approach, I forgot their name, would really love us.
I would still assume that it was pretty scary to pivot, right? When you need to make the decision to change the direction of the whole company. How lead us through that decision-making process?
Well, it's scary, but I think that you go across different conferences and you see where the market is heading. At one point, you see that you went over the cliff and you are not really standing on a secure ground, and you need to readjust. So it was mostly people say, "Oh, you're very courageous." No, it's just survival. You want to feed your children, right. So you basically need to change. And I think that I was always looking for what's next and what is right now, in order to make sure that we are standing on a solid ground.
Were there any moments when you thought, it's not going to work? We're going to, go bankrupt, close the company?
It's usually, it alternates between the morning or the afternoon of any startup. Anyone that was in this started a company, unless they have a very big organization or money behind them, have existential thoughts. You go basically from thinking, "Oh, I'm going to be a billionaire," into the next day, how do I survive? And then it oscillate. Always existential thoughts, and always feeling that you're going to conquer the world.
All right, I love that. Again, since I have some of the insider's information, since I worked for the company for almost 2 years, I know, for instance, that you managed to attract lots of big organizations like IBM, Medtronic, American Heart Association, and many others. I actually was manager in 2 of the last projects with them. And tell us how hard it was to close the contract with them, and how much time did it take, from the initial conversation and to actually signing the deal?
Remedy was able to get Anthem and Emblem Health and Village Care and VNS and a lot of Primera, a lot of others in a matter of few months. And the obvious thing to say, "Oh, we are just an amazing salespeople," but it was just coincidental that we met those people at the right time. And I think that the 18 months really depends when you are just waiting for that point in time to happen. Once it is done, for example, with Medtronic, it took us about 3 months to be up and running with a project.
Yep.
With them. So this was scary.
Yeah. It was pretty scary. But still, what would be your recommendation to startup founders? You as a fairly small company, you need to approach those big guys. How hard is that? I
think that entrepreneurs need to be like dogs. in that regard. If I have a very small dog, and they don't have a sense of size, and so you just behave like, and to some extent, this is kind of naivety that you need to kind of cultivate. And so, yeah, I've been entering a situation in which I thought this is crazy. And when I look back, I say, what the hell did I thought? Just do it. Don't think about your size. Think like a dog.
I really like that analogy. Did you follow the destiny of Remedy Health after you left the company?
So the company was acquired by OptimizeRX, which is a public company. It is mostly dealing with pharmaceutical companies, OptimizeRX, hence. And we did work with OptimizeRX to embed our technologies within their environment. I think that once we were acquired, COVID has happened, so this has kind of changed plans. Any company would have changed plans. And so this has been kind of very much like, companies like DNAs. So when they merge with someone, the DNA stays. And you look today, by the way, this is also interesting for my first company, which was called Softwatch, that provided CRM for pharmaceutical companies, and the second company, Remedy, that you look then, and after 10, 15 years, you see all the DNA, people, different positions, where they are, different companies that spawn out of it. So Remedy has its role with different things that has happened since then.
That's amazing. Investors right now, they're asking even early stage startup founders at the first meeting, like, what's your exit strategy? For Remedy, was that your exit strategy, to be acquired by someone from the day one?
Again, great questions, and I should say, by the way, that you said that we worked together, and I never see myself as a boss. And you probably felt that we were a team, and you were great in working on those very critical projects. So great questions. What was the question?
Did you have the exit strategy from the day one?
People say you should either be very aggressive about that, or you should focus about the product. I think you should do both. I think it's very important that you will always have your eyes on the money. And people say, this is not so nice, you should also think about growing a company. Right. But I think that if your eyes are on the money, the company, you are led into right directions. Okay,
that's really good.
But I'm on the other hand, I should say, I'm a Steve Jobsian, and so the product is really key, and you need to love what you do. So both ends.
Okay. So you left OptimizeRX back then, and you almost right away started a new venture, right? It's called Twig Health.
Yes.
Tell us more about it.
So that's, did a mistake again, third time. I think about, people ask me about entrepreneurship and all that. There is something S&M about us. If you know about the term S&M, I don't want, this is PG-13, so I won't translate the term, but you need to kind of be addicted to the pain. So it was for me almost natural to go back to yet another baby and changing diapers in the middle of the night again. That was the...
What does the startup do? What's the idea?
So when we started, we obviously start looking at different problems that we encountered in our experience. And one of the things that really struck us as kind of crazy was that we provided its technology, and we provided it to different organizations. Some of those organizations had phenomenal results with 80% engagement and great impact on their results and so on. And some had really failed. Now, the ratio was about 90% failed and about 10% succeeded.
Okay.
And we asked ourselves, this is sort of a very like a blinded trial. We gave the same medicine to those two types of organization. Why one organization fail and the other one succeed with the same medicine?
Why?
And those that were kind of engaging 0.8%, and those that were succeeding engaged 80%. So it was not just a little bit changing moving the needle, it was blowing the needle. Then we started thinking about, well, it might be not the technology, because we give them the same technology. It's something else about how they embed technology, their operations, their people. And we realized that the success, and this is something that I think is critical, is not in the technology, it's in the gestalt of technology, people, and process. And each one of them is important. And the companies that were successful were focusing on the people and on the processes to embed those technologies. So what Twig has been doing, being a Steve Jobsian or an Apple addict like myself, is saying, let's control not just one component, let's control the three components and provide it as a turnkey solution.
How would you do that?
So we have our technology, we have our own people, and we have our own processes. And so that was first stage, kind of understanding that we need to control. Second thing is understanding what really drives successful projects and what really engages. And for that, we got inspired by, again, Apple Store. Rather than if you think about an Apple Store, if you have a sick iPhone, do you go with your iPhone when you enter an Apple Store, do you go to the doctor? No, you never see the doctor. The doctor is the technician behind. What you see is a layer of engagement, middle layer, that they call the Genius Bar.
Okay.
Right? And this Genius Bar is a layer of optimization because it provides you an excellent service as a customer, but on the other hand, it kind of summarizes very clearly to the technician and saves his time, so what needs to be done. So he's not need to deal with you, which we will probably do a very bad job because he's a technician. So what we decided, this is part of us, we don't want to change healthcare organizations, we just want to provide this additional layer that will optimize how they engage their patients. And we're working predominantly with payers and providers, and on the other end, optimize also their teams, because now they are dealing with this optimizing middle layer, which can do much more than they could do before. So we can create for them, we kind of make them into superheroes.
Sounds interesting. So your previous experience, does it help a lot with your new venture, like in terms of managing, hiring, fundraising?
Of course. Well, you try not to repeat your mistakes, but you do sometimes. But from the standpoint of, for example, choosing what types of in digital health, and you can agree because you've been around the block for quite a while, things that look cool technology-wise really crush when you give them to patients. Patients don't, for example, like applications. Let's face it.
Right.
Patients don't like applications. Another thing, patients hate portals. They hate those. They also, and this is the new kind of flavor of the month, they don't like to talk with bots. Agent, I want to talk with an agent. I don't want to talk with press 1 or press 2. They want to talk with a person. So when we started to design a product for Twig, we decided to use a technology that is embraced by most people, which is SMS text messaging. So this middle layer is communicating with patients through SMS text messaging, and 98% of the population is using that, and it is installed on every phone out there. This is an app that exists everywhere.
Interesting, very interesting. So we recently posted a video called Trends in Digital Health for 2024. And one of them, which we think is pretty obvious now, it's outsourcing development outside of the US. Since now remote work is a new norm, it doesn't make much sense, at least financially, to hire a team on site. But there's still a myth, and I wanted actually, since you've done outsourcing a lot of times before in your life, can you break that myth to other startup founders that you do not necessarily need an on-site team to develop a HIPAA-compliant software?
You don't, or you?
You do not need an on-site team.
Oh, on-site. Definitely. I think that what we did great together is the fact that we didn't look at you as a separate team.
Right.
We were together. There was flying back and forth. By the way, as we worked together in Ukraine, we had also a development team in Palestinian development team. The same goes there. So once you establish that, I didn't feel any difference between talking to you or to anyone that was in Tel Aviv, as far as I knew that you will do an amazing job, as much as the Tel Avivian, if not knowing you, even better job. but so it was, I think, a matter of, again, relationship than anything else. Once you establish that, we just flew upwards.
Right, and just to add to that, with all the cloud servers out there, you don't have to need like physical on-premise servers to build a HIPAA-compliant software, right?
Today, anyway, as someone that has been a developer, today everything is components. You can separate things. You have best practices as far as building, agile approach, and so on. So outsourcing is natural, and we were we benefit from that consistently across those three companies.
All right. So 25 years in digital health, made a successful exit, now running another venture. For all the startup founders who are just starting this journey, tell us what's the secret sauce? What is the secret? How do you become successful in digital health?
I think that unlike other industries, digital health has different layers or more layers of issues, because you have regulatory. It's also an industry that is very disparate. You have different stakeholders. People will say something and then will do something. Will actually behave business-wise differently. So you need to kind of know how to navigate. So what really kind of I think is very important is first agility, because probably everything that you think, 80-90% will need to be adjusted. That's one thing. And secondly, having some experience. Because I know today, and I have some people now in the new company, and say, oh, let's do that. I say, this is dead on arrival. So for example, we were considering an application or a bot, this is dead on arrival. If you want to create something that is engaging. And so that's kind of, I think, the approach.
Good. Any other recommendations you can give?
Well, then once you move from healthcare into general entrepreneurship, in general, tenacity, persistence. I've done so many mistakes, infinite mistakes, and all of those really kind of brought me to where I am. And I'm continuously doing that. So kind of this agility to kind of assume, take into, understand your mistakes and kind of readjust, and always kind of lean forward as far as kind of your movement, because it is tough. It is tough. I mean, as you said, as I told you, you wake up in the morning and you think that you're going to die, and then you need to kind of still step out of the bed and kind of do a great job.
Well, let's not end our interview on the dead part. Let's give some more optimism to other startup founders.
So I think, by the way, I think that healthcare today is an amazing place, because if you look at industries today, tech industry is obviously very rapid, but it is a gigantic industry and it's quite saturated with technologies. Airline industries, banking industries, all those industries are saturated with technologies. Healthcare is still more or less in the 70s. We still have people in papers and fax.
Facts.
So an AI is a game changer. So getting into digital health now is an opportunity to have an open field of really great things to do, and it's also kind of warms your heart because you're helping people rather than just doing, I don't know, gambling or I don't know what else. Choose your own favorite, but right. it is really fundamental. Kind of, you look at this testimonial that we get, it warms your heart.
I love that. That's a perfect ending for our interview. So thank you very much, Amir. Thank you.
Thank you, Alex.